Okay. Bismillahirrahmanirrahim. Assalamu alaikum to all of you. Very good morning. Again, today I would like to welcome all of you to the nursing session. Yesterday we had a very good and very enlightening, very lively session. It was all because of our good speakers and our your participation. But one thing which is very important before I start the program to be announced, that nursing staff who is coming from Shaukat Khanum is on their study day. So your attendance from 9 to 5 is a compulsion, and you must mark your attendance in the system through RFID, and similarly at 5 o'clock you have to mark your attendance. And the second thing which is very important for today is that after these plenary sessions, we have our opening ceremony, and that is a big session, and we all have to be there. Not only nursing staff from Shaukat Khanum, but all those who are attending the session today, please be present and show your nursing presence. I would say Dr. Asad is standing at the back, but I can't stop saying me, show your nursing presence in those prestigious sessions, because this is very, very learning activity, and this is a very unique activity. People like us, we seek abroad to go and attend these sort of conferences so that we can update ourselves. And this is readily available at your doorstep. So please do not miss that opportunity. Okay. Right, so in today's plan, which is second session of nursing oncology nursing, our focus is focus of future nursing, education and practice. And we have 2 keynote speeches in that. And after that, we have 4 research papers, pre-papers, which will be presented by our young researchers, young nursing researchers. And they, as you know, that those papers are for award. Somebody in the hall will be watching and evaluating them. So for this session to chair, I will call upon Ms. Farida Khan, Assistant Director Nursing, Shaukat Khanum Memorial Cancer Hospital and Research Center. Please join us on the stage. Mr. Nasir Khan, Assistant Director, Shaukat Khanum Memorial Cancer Hospital and Research Center for IPD and ICU. Please join us on the stage. Unfortunately, Bisharatullah, the other assistant director, is not here because he is busy, his commitments in the hospital. So on behalf of that I just send apology, but I'll be officiating his session. To start the session with the glorious name of Allah subhanahu wa ta'ala, I'll call upon Mr. Shahid, Senior Lecturer Practitioner, Shaukat Khanum Memorial Cancer Hospital, for recitation of Holy Quran. Mr. Shahid, please join.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والتين والزيتون وطور سينين وهذا البلد الأمين لقد خلقنا الإنسان في أحسن تقويم ثم رددناه أسفل سافلين إلا الذين آمنوا وعملوا الصالحات فلهم أجر غير ممنون فما يكذبك بعد بالدين أليس الله بأحكم الحاكمين. In the name of Allah, the most gracious, the most merciful, by the fig and the olive, and by the more sin, and by this secure land, we have indeed created man in the best of the good. Then we cast him down as the lowest of the low. except for those who believe and do good deeds. There shall be an unending reward. What then after this can make you deny the last judgment? Is not God the greatest of the judges? صدق الله العظيم.
Jazakallah. So, to start today's session, after a wonderful session on innovation in nursing by Professor Parveen Ali, I would like to invite her to talk about higher education in nursing enhances career development. Professor Parveen Ali.
मुझे माइक दूसरा दे दें और दूसरा इसकी वो है क्लिक करना है Assalamu alaikum everyone. Thank you so much for being here today, and as Nasir has kindly introduced that we are going to talk about higher education nursing and how it enhances career development. जरा मैं माइक ले लूं क्योंकि मुझे इसके पीछे मैं पूरा छुप ही जाती हूँ तो किसी को मेरी शक्ल भी तो दिखे ना तो हाँ जी हाँ मुझे एक जगह खड़े रहने की बीमारी वो मुश्किल लगती है ना इसलिए ठीक है गुड थैंक यू सो मच दैट्स यूज़फुल अच्छा जी तो क्या प्लान ये है what we are going to do is talk about a little bit in terms of higher education in nursing and how I think the question is that it enhances career development. So in a way there's no question it does enhances career development और उसमें कोई rocket science नहीं है कि जिसको हमें नहीं समझ में आ रहा हो. So what I'm going to do is I'll give you an example. सबसे ज्यादा जो किसी को किसी भी तरह से पता चलता है किसी भी चीज का वो है through examples, and there is no better way of using an example and seeing somebody and seeing that अगर ये बंदा कर सकता है तो मैं भी कर सकता हूँ. ठीक है. और दूसरी चीज ये कि आप यहाँ पर से मुझे ये बताइएगा कि आप में से कितने लोग are related to oncology nursing and कितने लोग are related to other fields of nursing. So I can pitch that accordingly. Oncology, okay, and so that gives me it. Now nursing is a discipline के जहाँ पे हमारी जो cross क्या बोलना चाहिए movement है in other fields and within the subspecialties very usual, normal, or sometimes जहाँ पे subspecialties नहीं है वहाँ पे थोड़ा सा different लग रहा होता है. तो I'll try and talk generically. लेकिन principles जो हैं वो हमेशा same रहते हैं. Principles are not different regardless of which specialty you're talking about. It's how you apply to your career development. उसके अलावा एक चीज और याद रखिएगा कि खासतौर पे पाकिस्तान के हिसाब से और बहुत से लोग बाकी जगहों पे भी people think that higher education or getting a degree is your doorway to promotion, is your doorway to getting more challenging and more diverse positions, which in a way is really true. लेकिन जो higher education है वो आपको सिर्फ डिग्री लेके मैं शाउट करना शुरू करूं कि जी मेरे पास तो डिग्री है तो हुण ते मैनू तुसी ला दो पीएनसी दी रजिस्ट्रार ते किसी ने नहीं लाना. ठीक है. Because I should have the ability to then demonstrate how that degree that I have taken up is enabling me or is making me the right candidate to do that job. And believe me, it's not easy. ठीक है. It's not easy in the institution that you do. It's not easy in the organization that you work. It's not easy in the country that you work. It's not easy in another countries that you work in. But it's not impossible. ठीक है. ये हो गया. So This is Anne-Marie Rafferty, who was the RCN's president. So once she said that my nursing degree has been a passport to me, working all over the world, practically and academically, and because that has allowed us, to work internationally to all, and that is true for every nurse. If you look at today, nursing, having a nursing degree is a passport, and it can take you anywhere you want it to. And that is not limited to the profession of nursing only, outside profession as well, to other disciplines too, okay? And that's really very much true. And I think many of us here, Rehana, Nasir, and all of the other audience, Nasreen here, Lubna here, I'm taking the names, people who I can see and I remember. So it's not that I'm ignoring anybody else. They can probably would agree with that it is a passport that allows you to, and takes you everywhere where you want to go. So what I'm going to give you, my example, that how higher education has enabled me to be who I am today. And that is not to brag about कि मैं कोई बहुत बड़ी चीज हूँ या उस तरह से, but I think this person who I'm going to talk about, Parveen standing there, is coming from a place where you probably, most of you would have started, where you just think, well, who am I? Like, मैं क्या कर सकता हूँ? जहाँ पे जो एक notion है ना कि जी कोई support system होना चाहिए, कोई दूसरा कोई होना चाहिए, and that's how you'll be able to achieve something. I'm somebody who started all alone. So that's why I'm giving you this example, again, not to brag about myself, but to say, if this person can do it, you can do it too, okay? So my journey starts off from this little place, which was a Yasama Nursing Institute, Karachi, in the area of Liari. Liari का नाम सुना? ठीक है? Right reasons के लिए भी सुना होगा, ज़्यादातर wrong reasons के लिए सुना होगा, ठीक है? So, and this is a very, very small place. When I started doing nursing diploma program in this place, the Yasama Nursing Institute, Karachi, was established by Benazir Bhutto probably 3-4 years ago. I started there. So I think it was somewhere in late 80s जब established किया गया था, and I started studying in 93-94 as diploma in nursing. My ambition to go into nursing was, मुझे नहीं था पता होता, I'm eldest of 6 siblings, तो सबसे बड़ी हूँ, मेरे से छोटे 5 बहन भाई हैं, and मुझे नहीं पता कि nursing क्या थी, किस तरह सी. My only desire और जो attraction मेरी nursing में क्या थी, वो था सिर्फ मैं बच्चे छोटे होते हुए बीमार बच्चा हुआ करती थी काफी ज्यादा, and my father was in Pakistan Navy, so we used to go to PNS Shifa. तो मेरी only attraction जो थी वो यूनिफॉर्म था. आर्मी और नेवी की जो नर्सेस पहनती थी, that was my attraction because I wanted that uniform, and that's why I wanted to be a nurse. That's it. यहाँ से ज्यादा मुझे कुछ नहीं पता था कि नर्सिंग में actually होता क्या है. So this is the place where I started from. At that time, this place, nobody knew about it, but it is a place which has given me the foundation and who I am today. So I done diploma in nursing and midwifery from these institutions throughout that time period. When I was joining nursing program, लोगों ने मेरी अम्मी को और बाकी जैसे लोगों को बोलते हैं कि हाँ जी, लड़की पढ़ेगी तो खराब हो जाएगी, और खासतौर पे आपका पहला बच्चा is your guinea pig. आपके सारे अभी जो माएँ हैं यहाँ पे, वो भी किसी ना किसी हद तक, मैं खुद भी, मुझे पता है अपने बेटे के साथ कि वो बेचारा सबसे ज्यादा जुल्म उस पे होते हैं पहले वाले बच्चे पे, कि किसी को आपको भी नहीं पता होता कि आपने बच्चा कैसे पालना है, तो सारे जो चीजें आप उसी पे कर रहे होते हैं. तो मेरी वालदा जो है, शी वाज रियली वेरी मच अगेंस्ट नर्सिंग, और उसको लोगों ने ये भी बोला कि नर्सिंग ये कोई फील्ड है जिसमें लड़की को भेजना है, इसमें क्यों, ये कोई जाने की चीज है, नर्सें तो ये करती हैं वो करती हैं, अच्छी लोग नहीं होती, उनकी इमेज नहीं अच्छा होता. But then anyway, we went into it, and my father was a big supporter. Then 4 years in that particular institution, वो इंस्टीट्यूट ना सिर्फ ये कि प्रोविंस ऑफ सिंध में, बल्कि पाकिस्तान नर्सिंग फेडरेशन की हुआ करती थी. So after each examination, there used to be an annual competition between all the provinces, के जहाँ से provinces के जो position holders होते थे, and they used to be ranked that which province came first. So not only the province of Sindh, but throughout Pakistan, I remained position holder for 3 years or 4 years time when I was there. That changed the perception of not only my mother, but people who were against nursing and who were used to say कि अपनी बेटी को क्यों डाला है, many of those people still come to me even today to get their children, to get their daughters and to get their sons into nursing. तो एक इंसान की अच्छी एग्जाम्पल आपको एक पूरा रिपल इफेक्ट देती है कि जिसमें वो चेंजेस आ सकती हैं. And after me, 2 of my siblings are nurses themselves. So that was when I had that problem, but they didn't have it because of the examples. So then we moved from there to Aga Khan University, Karachi. This is another place which is part of my identity and makes me who I am today. This is where I completed post-RN, BSc and Masters in Nursing program. I didn't have any money. If I didn't have the scholarship of Development of Women Health Professionals program to do the BSc at that time, I don't think I would have done BSc, and I don't think I would have known about it. And how I knew it, the mentors and people who knew that you were doing good, they referred me to it. They told me, this is the program which is coming, go and give a test, jaake do, yahan pe apply karo. And that's how I got onto the post-RN BSc program and then to master's program. That enabled me to work within the country, within Aga Khan University as a instructor at that time, before I moved to UK in 2005, 2006. I moved to UK because my husband was wanted to study, and I thought that, okay, abhi tak to, I have always been the youngest one in my BSc ki class mein. I was the youngest one, masters ki class mein. So I was like, I have got quite a few years ahead of me. So agar main nahi bhi padhungi, so that's fine, but he can study. But jo log nahi sukoon se baith sakte. So then in the UK when I went, it was a fresh start again. So Parveen Rahman ka naam jo yahan pe log jante the Pakistan ke andar, it was a name, it was a recognition, people knew it. But going to another country, starting all over again where nobody actually knows you. So that's where I started doing my PhD in 2007, 2008. There are different challenges associated with it, but that's fine. I'm not going to talk about them. But doing PhD in nursing and working as a research associate at the same time, developing some teaching abilities. So the opportunities which were provided by this place, Ayasama Nursing Institute and then Aga Khan University, they provided a springboard to be able to achieve what I could in another environment. So reflections which we studied from Miss Anne, जो कि बहुत मुश्किल लगता होता था, बहुत सी दूसरी चीजें, they provided a stepping stone to be able to complete the PhD timely and then to work on different research projects and teaching projects and everything else. Which then, so this is the University of Sheffield where I completed the PhD program and then also worked there at different positions. और फिर इसके बाद my first position as a lecturer was at University of Hull. यूके में या पाकिस्तान से बाहर जब आपको अपने मुल्क में इतनी मुश्किलात होती हैं तो समझ लो कि दूसरे मुल्कों में जहां की आपकी शक्ल भी नहीं है लोगों के जैसी, बाकी लोगों के जैसी, आप कोई बहुत ज्यादा अक्लमंद भी तसव्वुर नहीं किए जा सकते. So how difficult it would be. Generally speaking, people say that you have to be 200% better than your white counterparts to be able to get the same positions or get the same opportunities that they have. Okay. But this place, and then fast forward now, I work here at the university and the hospital as professor of nursing, as professor of gender-based violence. I am the second, Pakistan se bahar ki baat kar rahi hu. Pakistan se bahar, I'm the second Pakistani professor. There is one more in America. AKU ki he graduates hain. She became professor just before me earlier on, and I'm the second one in throughout the world. Within UK, I'm the only professor. अब जो बात बताती हूँ वो मजे की है. Within UK, I'm the only female professor, Pakistani professor in any field. That's not nursing, that's not medicine, that's not, it's everything included. I'm the first one who got that particular position. I lead a network called UK Pakistan Science and Innovation Network, which is a consortium of all British Pakistani academics who work in all the universities in the UK. And then we work with all the universities in Pakistan. And again, that's not nursing, that's multidisciplinary professions. We have engineers, you have AI experts, you have, you name it, and all those. So we have got about 300 odd professors and other people working across in the UK and then in Pakistan. And I chair that network as a nurse. Okay? I sit on the, I'm the editor-in-chief of International Nursing Review, which is the ICN's official journal. And again, I'm the first ever Pakistani editor-in-chief at that level. So nursing के तकरीबन हमारे पास दुनिया के अंदर 122 journals हैं जो ये recognized list पर आते हैं. Cleverate list है एक जिसमें सारे journals जो recognized हैं. 122 journals recognized हैं. 122 journals के अंदर आपके पास कोई पाकिस्तानी, कोई South Asian, कोई नहीं है. I'm the only one. Last time we went to editors conference के अंदर, I was the only Asian face in that particular room, which had about 300 odd people sitting in there. ठीक है? So how have I become that? What has happened? There is no money involved. There is no कोई favoritism या कोई उस तरह की कोई चीज involved नहीं है, कोई कुछ नहीं है. It's all because of who you are, and it's all because of the educational opportunities, and it's all because using those educational opportunities to make the way for yourself and for others. Okay, so this is I just wanted to give you this example. Now, of course, this is the very broad view of the examples in terms of teaching. आप क्या करते हैं, दूसरी चीजें कौन सी करती हैं. So it's how you utilize that education to be able to make a place for yourself, for others. But that's one example that I just wanted to give you. This picture is from Sigma, where I was the first ever one to get Emerging Nurse Researcher Award at European level. This picture was taken at that time, so I've just pasted it here. So in terms of research, I do various different things. So as a nurse, example यहाँ देने का मकसद ये है, because we come from a very generic knowledge base. ठीक है, हमारे पास हम साइकोलॉजी पढ़ते हैं, फिजियोलॉजी पढ़ते हैं, हेल्थ रिलेटेड सब्जेक्ट्स पढ़ते हैं, बहुत सी ऐसी चीजें पढ़ते हैं कि जिससे आप you would find generally that we have got a very generic knowledge base which enables us to be fitting in any disciplines or in any problems, and we can study that easily. When you will start joining kind of forums, you would realize कि जहाँ पे लोग बात कर रहे होते हैं ना बड़े-बड़े executive levels पे, and when the courses that they do, and at that time they talk about emotional intelligence, change management, leadership qualities, तो मुझे बड़ा मजा आता है जब मैं वहाँ पे ये कहती हूँ, well, I have learned this in my childhood. Because these are the things जो लोग जाके पढ़ते हैं जब उन्होंने बड़ी positions पे काम कर रहे होते हैं at that time. We learn that from the diploma or undergraduate levels. ऐसा है ना? Reflection सीखते हैं, change management पढ़ते हैं, conflict, self-awareness, all of those concepts that people study quite later on, we do that at the start of our education. So therefore, that allows us to work at different places. This is one of my research areas where I work. And this is some of the context of, around gender-based abuse that we do. A couple of notable things that I have done. And again, this is an example of what you can do. This is one of the courses on Future Learn. So this platform, have a look at this platform. What it does is it has got millions of courses which are given free unless you ask them for a certificate. अगर certificate नहीं लेना तो आप courses free में कर सकते हैं. If you wanted a certificate, they charge you a little bit of fees जो आप दे तो वो करते हैं. यहाँ पर ये वाला जो course है supporting victims of domestic abuse. This was first ever course talking about domestic abuse in an online sort of format. और यहाँ आप देखेंगे it shows about 11,000 enrolled students and ये पुरानी है picture. And I have more than 22,000 students on this module from all across the world. And again, this is using your abilities of digital learning and technology and the knowledge that you have about a particular subject to use it for advantage. This is a game, interactive board game, which I developed earlier on. Now it has changed to digital game, which started off with nursing students because we wanted to help them learn aspects around safeguarding or किस तरीके से protection कैसे होती है. Now it is used by social workers, police officers, people who work in domestic abuse setting and other aspects. And again, that's like taking the challenge on. So the point I was trying to make is that, so it's the higher education, but then it's using your abilities, using your knowledge, working with other people to be able to then achieve something. ठीक है, हमेशा छोटे से स्टार्ट होता है, थोड़ी सी चीज से स्टार्ट होता है, एंड देन आप उसको बढ़ाते बढ़ाते आगे किसी भी जगह पे लेके जाते हैं. अगर किसी को, I love giving examples, simple examples which people understand. कभी घर में दावत की है किसी की, तो जो पूरा इतनी 8 या 10 डिशेस बनानी होती हैं, कहाँ से शुरू होता है? सब्जी और दूसरी चीजों की छोटी छोटी चीजें आती हैं, फिर then you start one by one ना. इसी तरह से when you start slow, it allows you to get there. So higher education, why do we need it? Because it provides us that kind of a stepping stone to be what we want to be in our lives. And it helps us pursue advanced careers and job roles. So some people would do a higher education just because they want to progress into their career and they want to go for advanced job roles. It's a very good reason to do it, but please don't go for higher education just only for this reason. क्योंकि सिर्फ अगर जॉब रोल्स के लिए अगर आप जाने की कोशिश करते हैं, दैट्स योर बिगेस्ट मोटिवेटर इन योर हेड, तो क्या होता है कि अगर आपको खुदा ना खास्ता और अर्लियर ऑन मुश्किलात, तकरीबन हर किसी की अपनी स्टोरी होती है, अगर आप पूछोगे लोगों को तो वो अपनी अपनी बता सकेंगे. बट इफ यू ओनली वेंट फॉर हायर एजुकेशन बिकॉज यू वांटेड अ बेटर रोल, एंड इफ यू वर नॉट एबल टू गेट दैट बेटर रोल फॉर a couple of months or 6 months or something like that, you will start getting frustrated. So therefore, go for higher education for job roles and everything else, but integrate that into your life so that it makes you a better person and it makes you a better individual who can go for different opportunities. It provides you with an opportunity to help our patients. Like when it comes to nurses, that's what we want to do, because it helps us develop the skills of critical thinking. It helps us think through things, make appropriate decisions. But what we are not very good at as nurses is owning those decisions and thinking that we are the one, I'm the one who has made that decision. Okay, so pause, stop, think, what is it which I have contributed to? किसी ने नहीं मानना, कोई ना माने, but if you know what you have contributed to something and how you have achieved the problem, that's going to allow you to develop yourself for the next challenge as you move forward. ठीक है? Okay, and as I say, it helps makes better decisions for self and others. And expands knowledge. So that's the reason why we should be going for higher education. When it comes to nursing, I have used this example from the UK, but you will find all across the world, the examples are pretty much similar. नाम थोड़े से different होंगे, courses के और चीजों के, but they are pretty much similar sort of rule that you come into nursing earlier on as entry point. Sometimes people start off with as nurse aid या उस तरह के route से लेके आगे develop करते चले जाते हैं. Or you can go into undergraduate programs and then 3 years or 4 years ke programs, and depending on which country do you study, which allows you to register as a practitioner in the country where you are getting that education from. And then from then onwards, you have got wider sort of options available depending on what you want to do and where you are. Okay, so there are undergraduate programs jahan pe aap apna kar sakte hain. If you have got a diploma, then you can upgrade it to a degree level. If you've got a degree, then you upgrade it to other levels. Those you can do it, or you can have usually aajkal majority of nurses in majority of countries are at undergraduate levels, though associate degree programs and other aspects have started all over again. So that's one thing to know, but that's where you start off, and then at postgraduate level, and then you can go on to doctorate levels. At postgraduate levels, generally speaking, regardless of which discipline or field you're talking about, so if it could be oncology, nursing, or pediatric, or psychiatric, or anything, but the levels that you have is either you can go into advanced practice, so you could go, you will find postgraduate programs that help you develop within advanced practice, or help you develop research or leadership. So these are the specific ones, or you go for masters in oncology or masters in this. Regardless of which route you take, sometimes it is probably better to go for a generic route, but then use the examples of the work that you are doing if you wanted to do. It also depends on your funders. If it is the organization, they may have vision and they may want to have people with specific knowledge. So for example, Shaukat Khanum may fund people to do masters in oncology only. Okay, that's different. But if you were funding yourself and if you wanted to do in oncology or pediatric or something like that, that's fine. But if you wanted to give yourself a broader base, you could go for a generic master's program or doctoral program, but you could use the examples or the situations related to oncology to be able to develop yourself further and study that program and develop your knowledge base further, which will still develop you as a leader in that particular field and as an expert into it, but it just gives you a little bit broader basis. Okay. PhD level, there are two types of PhD. One is the doctoral nursing programs or doctorate programs, they call it. Again, they may be different titles used in different countries, but these are practice oriented programs जो कि ये करते हैं practitioners को, कि जो leaders हैं, managers हैं या clinicians हैं, it allows them to complete the program in smaller chunks, or usually एक छोटा relatively small project होता है research का attached at the end of it. It's like an extended master's program, basically a little bit more advanced. So that's one thing to do. But if you wanted to develop your career as a researcher, then it's the PhD program, which is for you, which is usually 3 to 4 years program that you need to do. Kitni der hai mere paas? 2 minutes. Okay. So usually people, what I will do is I'll just go through a few questions, normal questions जो हर कोई पूछता है, और उसके मैं briefly answer करने की कोशिश करूंगी. And then if you wanted, you can talk to me always. Which program shall I go for, undergraduate or postgraduate? Well, it depends on who you are and where you stand. If you already have an undergraduate degree into nursing, go for a postgraduate program. It could be within nursing or outside nursing. लेकिन एक बात याद रखो, हमारे पास, मैंने जिंदगी में बहुत सी nurses को support किया है, हमारे पास ना हमें problem है में identity crisis, सानू पसंद नहीं आता सी नर्स आवा, ठीक है? तो हम वो तरीके ढूंढते रहते हैं किस तरह से निकलूं यहां से बाहर जहां पे मुझे कोई नर्स ना बुलाए, छोड़ता फिर भी नहीं पीछा. उसमें याद रखने की चीज ये है कि वो एक बड़े बचपन में मैंने एक चीज मेरे अब्बू ने मुझे सिखाई थी, कहते हैं पत्थर अपनी जगह पे भारी होता है, ठीक है? और उसका मतलब ये है कि इफ यू हैव गॉट बेटर ग्राउंडिंग इन नर्सिंग, ठीक है, so then it's easier for you to grow and develop yourself into that profession, or using that example into other professions. Go and become an HR consultant, that's completely fine, but perhaps specialize in nursing personnel or healthcare professionals. You will be successful in a better way rather than going into and doing generally HR, because फिर उसमें आपको मुश्किल होगी. तो try and use the strengths that you have for your advantage and be proud of it. Which university shall I choose for a higher education? Local, national, international. Use the universities which is good, which you can compete with. Now, why I gave you my example, it doesn't matter which university you go to. लियारी से पढ़ा है ना, मैंने कभी सोचा था कि I would like to be, I will become a professor of one of the kind of, prestigious 100 ranking में, world ranking में universities आती हैं, वहां पे जाके उसकी professor बनूंगी या कुछ करूंगी. नहीं, मुझे नहीं था पता. Would somebody have expected somebody studying from Lyari would be able to do it? नहीं. AKU, perhaps people would have expected कि हाँ जी हम कुछ अच्छा करेंगे, but I don't think even there we expected or we thought that we would get that opportunity. So it doesn't matter, as long as you are good at what you do, you can create your path. जो university, जो place आपको जगह देता है, आपके लिए convenient है, affordable है, appropriate है, यूजफुल है. हाँ, जाली यूनिवर्सिटियों में ना जाना, ये है बात अपनी जगह पे. Look for the options or universities which are, if you are working in Pakistan, make sure that these are acceptable from Higher Education Commission Pakistan, ताकि फिर बाद च लड़ाइयां ना पईयां होण उथे कि जी मैंने तो मास्टर्स कर लिया, मेरी डिग्री रिकॉग्नाइज करो, कहंदे नहीं ਅਸੀਂ ਤੇ नहीं कर रहे. So make sure that you have explored that and you've looked at that. Everyone has done PhD, masters, that's why I want to do it. पूरी दुनिया खड्डे में गिरने जा रही है, गिरने का शौक है? नहीं, it has to be you. Why is it relevant to you? Why is it that you want to do it? And if you want to do it just because मुझे अपने नाम के पीछे MSc लगाना है, that's fine. But the reason has to be you and the reason has to be yours. Okay? Does that make sense? Shall I do a doctorate or a PhD? What is the difference? इसका difference मैंने बता दिया मेरे ख्याल में. It depends on your career goals and it depends on the practices that you're doing and it depends आपकी उम्र कितनी है, आपके पास कितने years of experience आगे है, आपकी expertise कहाँ पर है, where do you find your strengths, and again using your strengths appropriately to develop your career rather than going for a degree which probably you won't be able to use. Online education is reliable. Online education is reliable if you have done from a credible university. ठीक है? The online education में उसने दिमाग में घुस के टेलीपैथी के थ्रू अंदर नहीं घुस जाना, उसे भी एफर्ट करनी पड़ती है, ठीक है? बड़े सारे लोग ऑनलाइन एजुकेशन इसलिए उसका वो भी हुआ है कि लेते हैं because they think online education is easier route. Actually, it's a very difficult route. ठीक है? क्योंकि क्लास के अंदर बैठे हो ना, मैं खड़ी होकर बोल रही हूँ, चुप करके सुन रहे हो ना सारे, ठीक है? कुछ अंदर जाएगा, कुछ नहीं जाएगा, कुछ याद रहेगा, कुछ नहीं याद रहेगा, 4 लोगों से बात करोगे हो जाएगा, इजी है। खाली सुबह उठना था, यहाँ पे आना था, क्लास में बैठना था, अब कुछ ना कुछ हो ही जाना है। ऑनलाइन एजुकेशन उठना भी खुद है, कंप्यूटर का बटन भी खुद दबाना है, मुंह भी खुद साफ करके बैठना है, फिर सोचना भी है कि फिर दिल चाहेगा कि अच्छा जाके खाना खा लूं, अच्छा नहीं ये मूवी अच्छी आ रही है, ये देख लूं, थोड़ी देर इसको बाद में पढ़ लूंगा। So you know there are so many limitations that you have to work through to be able to do the education. So it's a difficult route actually. ठीक है? But choose wisely. It's an appropriate route, but ask somebody if you want to go for it. Is it acceptable in the place that you have? Go back to is it acceptable by Higher Education Commission? Because that's a regulatory body. अगर उसको acceptable नहीं है तो अच्छा भी होगा, अगर तो भी फायदा नहीं है ना, क्योंकि you know it's not going to help you develop it. If you have done that, then you can make it happen. So make sure that you've made that, done that research. Shall I choose a supervisor first or a topic first?
Sorry, Professor Praveen, you have 1 minute to.
Khatam kariye.
Thank you.
ठीक है? Shall I choose the supervisor first or topic first? जूता पहले लेके कपड़े ढूंढने नहीं जाना चाहिए, करते हैं बाज लोग ऐसा हम, ठीक है? हमेशा पहले जो चीज लेनी है वो choose the topic first, choose the aspects first where you want to go, and then look for people who are able to support you and who are able to give you guidance as to where you want to go. Which topic is trendy for PhD? No topic is trendy for PhD. The topic which is trendy for PhD is the one that you want to do it and why you want to do it. ठीक है? Look for things that you think are available and there is a need and that's what I want to do. फिर उसके बाद जाके थोड़ी सी रिसर्च करो, ठीक है? कितनी दफा मेरे पास एक बड़े मजे का सवाल आता है। एक दफा किसी एक खातून ने फोन किया, वो कहती हैं अच्छा जी मुझे पीएचडी करनी है तो मुझे बता दें आपके यूनिवर्सिटी में कहाँ पे क्या है। अच्छा जी मैं लड़के बैठी हुई थी किसी और के साथ, तो मैंने कहा जी ये हैं अपॉर्चुनिटीज। फिर कहती हैं अच्छा, तो फिर एक और सवाल किया, फिर मैंने कहा अच्छा जी ये है। फिर कहती है अच्छा फीस कितनी है? फिर मैंने कहा ऐसा करो ना कि आप उसको गूगल में डाल के देख लो ना, मतलब एवरीथिंग इज अवेलेबल। नहीं वो तो है ना, पर मैंने कहा पूछना आसान है, तेनू पूछना आसान है, मैनू कोई और काम नहीं होता। So do your research because people will tell you on the top of your head if you are interested in something. जैसे कपड़े लेने जाते हो, शॉपिंग करते हो ना, 4 दुकानों की फिर एक जोड़ा खरीदते हो उठा के, है ना? ऐसे इधर भी करना पड़ता है, ढूंढो, देखो, पढ़ो, समझो and then make your decision. And will I get a scholarship? Yes, perhaps you can, depending on the topic. अगर वो आपने वो choose किया जिसमें आप passionate हो, then you can inculcate that passion to other people. And then yes, there are ways to find fundings. Talk to people who can guide you and take that forward. Talk to people doesn't mean कि सब्जी वाले नु जाके पूछोगे scholarship है कि नहीं. Choose the right people who can give you that answer, and when somebody gives you an answer or guides you, go and do that work. ठीक है? फिर काम होना है। उसको मैंने फोन करके प्रोफेसर परवीन को पूछ लिया, ये बता दें, उन्होंने बता दिया, अच्छा जी आप तो बस खुद ही नहीं, उसने तो खाली तुम्हें जवाब दिया है ना। Now you have to go and work harder to take that further. So these were some of the questions. I'm really sorry I've taken long, but thank you so much, and I'll be more than happy to answer any questions later.
Thank you, Dr. Parveen, for very practical examples on the topic. And the participants can see you after the session, maybe in the hall or in tea area for further questions. I just want to clarify that Shaukat Khanum doesn't restrict to oncology. The opportunity, any field in nursing, if somebody wants to excel, they can apply for that. But of course, behind the scholarship or funding, there is a year of experience working with Shaukat Khanum required, because not everybody just come new, join us and take that scholarship. But it could be any field of nursing. Yeah. Vested interest, yeah,
because
vested
they
interest.
want people to develop into something specific, so they may want you to do it X, Y, Z. So those opportunities, but then you can create your own opportunities if you wanted to go for specific programs based on your needs. Yeah.
Okay, so our next talk is also about education, and it is about supporting nurses. The topic is preceptorship, a tool to build the capacity of nurses working in oncology setting. Experiential reflection will be given by Nasir Khan, Assistant Director, Shaukat Khanum Memorial Cancer Hospital.
Thank you very much. So we have wonderful places for where nurses can enhance their education and ultimately they can improve their and enhance their career. We have hospital at Lahore. It's a wonderful hospital. Shaukat Khanum Hospital, Peshawar. And very soon we will have Shaukat Khanum Hospital, Karachi in 2023. So we have these opportunities and where excellent opportunities are for nurses. The outline of my presentation will be preceptorship and mentorship, brief history of preceptorship, different approaches to develop preceptorship in oncology nursing and what we have done in our setting and some of the challenges and the way forward. So academically, if we can see, preceptorship is the clinical learning method, which is adopted by many healthcare sectors, not only nursing, but also in occupational therapy, pharmacy, and medicine. It also involves the pairing of more experienced and skilled nurse preceptor, assigned or paired with the newer or lesser experience, who is called as preceptee. And the preceptor-preceptee pairing offers opportunity for one-to-one guidance in clinical areas and where the opportunity for enhancing clinical experience is done. So mentor is naturally formed where the preceptor is to be pre-arranged by the institution or the manager or someone who is supervising the unit. Then mutual benefit is there where the mentor and mentee, there is a mutual benefit. But for the preceptor, it's more directional. It's educational type of activity where you enhance the competency of a new nurse. There is no formal preparation required for a mentor. That is the experience and the educational thing that they can have. Like we have experienced nurses from and experts, they can be a mentor. But for preceptor, we have to prepare them. There should be some sort of education for them and to prepare them for that role. Then the time limitation is with the preceptorship. There should be some time set according to the goals that, okay, for this time period, these will be the learning objectives and these will be the outcome of this interaction. So if we see the history, so in 1800, the student nurses, they were supervised by senior nurses and they were in pair, and this is also given in the literature. Till 1960, the concept of preceptorship was remained dormant for decades. And in 1960s, when in US, the nurse practitioner course was introduced, so the preceptorship was reintroduced, but this role was given to physicians because the idea, there was a common saying that only physicians can teach nurses because of the capability of nurses that was questioned at that time. And then since 1970s, it is like in the momentum. And 1980s, the Banner model was introduced where the from novice to expert experience. So Patricia Banner, she introduced this model and this was published in American Journal of Nursing in 1982. And this was again the module where the idea was how the novice nurses can be developed to expert. And for this model, if you can see, we cannot ensure that a plant can grow without providing a medium or a support at the ground. So preceptorship is some sort of support where you can bridge from academic to clinical site, and nurses can grow and will not experience any reality shock or some or other resistance. So there are three different approaches for preceptorship development. Sometimes the university-based hospital, they use it for academic practice partnership, where the student nurses, they are assigned to the senior nurses who are trained for this role. And it can be a three-tiered approach where this is given in the literature that if this is done in 3 phases, we will talk about later, and online preceptorship education program. So in the digital world, there are many opportunities where you can, if you are a senior nurse, you can go and search for those programs, and at your own convenient time, you can do this. There are some skills which are also required for preceptorship, for preceptors. For example, they should have to initiate a role, they should have some sort of skills in their portfolio. And for facilitation, working with people, they should have good people skills. For implementing, they should be able to plan and manage the change process. And this is all about their experience. So preceptorship model in oncology, this was a one study which was done in US, and this is basically designing and implementing this program in oncology setting. So they have sketched this model from novice to the expert based on the Banner's model, and they have divided this into 3 phases. In the first phase, since oncology setting is very complex setting, and it's not like the general ward setting, there are some specific skills that a nurse have to have. So there is 1:1 interaction, and the time period which was given in that project was 8 to 12 weeks. And after that, 2 years of lengthy experience was expected, but that was not a formal preceptorship. That was converted into mentorship, and then informal mentorship, where the support is provided and available. So some of the roles which were identified in this study was there were educator, preceptor, preceptee, and then the manager relationship. So these are from preceptor to preceptor, there should be a close interaction. And manager and clinical educators, like in our case, we have clinical nurse practitioners, so they can be in this part. Okay, in our hospital, we have a formal procedure for preceptorship program. We have initiated this, and this is to help and support those nurses who want to join and who are coming to the hospital. So this program is currently offered, and there is a purpose of this program. There is a criteria that how a preceptor can be selected for this. There is a training which is offered, and there are responsibilities which are written for the clinical nurse manager, preceptor, and preceptees. In our preceptorship program, we identify preceptors based on the criteria. And there is a formal program which is given, a 4-hour session where the training of them is in class. But to enhance their critical thinking, we are also expecting that they should be going for poster competition. They should look for good ideas, and they should look for things which are related to preceptorship or clinical setting. And they should also search for some evidence-based article where they critique, and just to enhance their critical thinking skills and to search for some new items on this agenda. And then they are going to the clinical units where they are supported by the clinical nurse managers, and they are assigned to the novice nurses are assigned to them. Feedback, learning contract, and progress reports, this is ongoing, which is there in coordination with the nurse manager. And research, so this is a question mark, and we will be, inshallah, doing to see the qualitative aspect of this, how the people, they are perceiving this experience from nursing as well as from the preceptor's point of view. So this is the first batch which we have introduced, and this was recognition by the nursing division for preceptors in the clinical area. So the challenges. What are the challenges? We have senior nurses here in this, and there are some nurses which are also preceptors. So in the literature, this was a study which was done in the pediatric acute care setting. It was a quantitative study, and from the 1993, 1999, 2007, and 2013, these are the 4 different studies which were done. And if you can see the comparison of means. So preceptor perception of benefits and rewards. So in the 14-item questionnaire on 1 to 5 scale, it is 1 to 10 scale, it is at the middle. So there was a feeling that their benefits and rewards was not up to the mark. And the preceptor's perception of support, again, you can see the score. It was no change since the first study was done in 1990s. And commitment to the preceptor roles, it was, again, not reported in first 2 studies, but this is scored 4.81 and 4.74. Some other challenges where it was it was a qualitative study where the data analysis were done, and some common themes that were emerged, that preceptorship is a challenging and stressful role, because along with the clinical assignment, you cannot give proper time to new nurses or students. Lack of support and lack of appreciations. These were the common themes. So for any challenge, for any profession to grow, there are basically this gap should be minimum. If there is more gap between research, practice, and theory, then this is very difficult for nursing to grow. So the way forward, I think there should be formal training. We have started this training and we will enhance this more. But nursing is not only limited to Shaukat Khanum, it should always be a formal training for senior nurses to be a preceptor. Teaching, coaching, specific competencies should be there for preceptors. Follow-up and feedback. Recognition of their role is very, very important, and research. Thank you.
Thank you very much, Mr. Nasir Khan. Now we would be moving to the second part of the symposium, and that is the presentation of the research papers. I would like to remind the presenters, please note that you have 12 minutes for the presentation and 3 minutes for the question answers. So we request you to stick to the time. With this, I request Mr. William Chaman to present his research. And William is working as a nursing lecturer practitioner at Shaukat Khanum. His title is Nurses Presence Perceptions of Cancer Patients Receiving Chemotherapy. William, over to you.
Good morning and assalamu alaikum. Thank you very much, Ms. Frida. You have introduced me. This is a small piece of work I have done in my master's study. I am oncology certified nurse. Thank you very much. I ran my BSN from bachelor's of from a University of Lancashire in England, and recently I completed my master's from Philippine Open University. I'm very thankful to hospital administration, nursing division. I'm thankful to Ms. Rehana, who approved my study to support my finances. I am thankful to Mr. Yusuf, who supervised me in my studies, and Mr. Rashid Bilal, who helped me in correcting the English part of this stuff. So my university professor, Ms. Rita, who is not present, but I am thankful to all the members who are written here. So when I see the background of this study, we can see that cancer is increasing day by day. This is WHO report 2018, where we can see that there are multiple cancers which are occurring in Pakistan, and about 118,000 people die in 2018, which could be prevented by doing some strategies with the patient and families, and spending time with them when they are free. And when we go to the patient, when we are on the bedside of the patient, we can spend a quality time with the patient. That patient may also benefit. So cancer is increasing, and chemotherapy, one of the treatment modality nowadays for the cancer. This is the chemotherapeutic agents. So the chemotherapy has many harmful effects on body, mind, spirit, and family life also of the cancer patients. Sometimes it has become difficult for the cancer patients to overcome the disorder because there are not only physical issues, but some spiritual and sleep and anxiety and psychological and many other family issues which patient faces in front of while they are receiving in chemotherapy. So nursing presence is a concept which is not new, I think so, but I am introducing in Pakistan. I'm giving you the concept which is not in the world. Nursing presence is one of the measurable tools with which we can determine the quality of life services a patient deliver when is delivered by the patient as satisfactory or not. So this is a tool where patient can tell us what quality of care we have provided, whether they are satisfied with the care or not. Here are some important operational definitions. Nursing presence is the as defined in dictionary, that presence as being with and attending to another, involvement and companionship. When we are on the bedside, as I told earlier, when we are on the bedside, we should cash that time to teach the patient and the family of the cancer patient. Perception is the organization, identification, and interpretation of sensory information. So cancer, as you all know, is a disease which is affecting family members and families in Pakistan and anywhere in the world. Chemotherapy is the medication or the drugs we treat with the cancer conditions. So aim of the research was to evaluate the perceptions of cancer patients about nursing presence while they are in chemotherapy receiving phase. This study is conducted in inpatient department where patients are admitted for the chemotherapy. And the specific objective was to determine the patient perception of nursing presence receiving chemotherapy in inpatient department. The second was to determine the relationship between demographic of patient, sex, age, marital status, and education of the cancer patients receiving chemotherapy. This is a very significant study, I think so, because this is an innovative topic, and in the field of oncology, this will work very much if we incorporate in our studies, in our teachings, in our practices, and in our all the things which we do with the patients. The result of this study may help evaluate the effectiveness of the education provided. Shaukat Khanum is providing education since the nurse joins. We do induction orientation program where we teach how to handle chemotherapy and how to handle, how to take care of the complications risen from the chemotherapy treatment. So nurses may engage patients in period of chemotherapy with the potential of developing professional relationship and educate them to overcome the expected complications they can come across the chemotherapy. So nurses will be able to have a strong relationship in between patient and nurses will be built, and patients will benefit by reporting side effects they experience. So early detection will be possible. Organization will keep up a quality of care services to cancer patients. Patients receiving chemotherapy will be more satisfied with the care they are provided. In education point of view, nurse educators will introduce the concept to their students about the nursing presence. So this study may open the roads for further research in development and discover new pathways and competencies of evidence-based practices in relation to achieving the more effective nurse-patient relationship. This study, the piece of work I have done is limited to oncology setup, which is situated in Pakistan, in Lahore. So therefore, results cannot be generalized in all patients and not even cancer patients, but only those who are admitted in inpatient department and are receiving chemotherapy for their cancer. I have not found much literature on the patient's perception of chemotherapy, patient perception of nursing presence receiving chemotherapy. Only an article I have found is cancer patients' perception of nursing presence. This is an overall. This is the study where all the okay. So literature is limited in the database. Jane Watson's theory, I have applied Jane Watson theory, which emphasizes holistic care. Not only we have to do physical, we have to take care of the patient psychologically and spiritually also. This is a descriptive correlational study and is run in inpatient department. I have used Carol Koswich's nursing presence tool, which has two sections, section 1 and section 2. Section 1 is a demographic data of the patient, and section 2 consists of nurses' sensitivity for patients' concerns, giving the plenty of time, asking for the needs and problems, patient comfort, psychologically, emotionally, and may extend their help when the patients are in chemotherapy. This was a small study. By calculating, it was necessary to interview 79 patients who are in chemotherapy. So there was some inclusion and exclusion criteria. Inclusion criteria says the patient should be adult and conscious, oriented to time, person, and place. Patient is admitted 24 hours. Chemotherapy has patient received, and patient is able to understand Urdu. Patient can able to understand Urdu and could be able to write, could be able to read Urdu. So those who are on outpatient setting will be excluded from this study. When we see the phases of this study, first of all, by generating an formal application to the research department, a proposal was submitted, and research went through ethical research review committee and all the what we can say bioethical considerations I have considered here. There was this was the tool which is developed by Carol Koswich, and I have translated in Urdu. So this was distributed to the patients in Urdu form. This research was gone through scientific review committee and institutional board, and I have attached their letter at the end of this. So anyone would like to see letter, I can show. The result shows that there were 53 male and 36 female patients, and the mean age of the was 34 or 35 years. Some of them was, many of them was non-educated, and the primary level education. There were 70 patients who were educated, who were BA degree holders. When we see the results, the interpretation of this result says that the nursing presence was positive if the score was more than 3.6. And if less than 3.6, and if the nursing presence was present, negative patients were in mean 3.5 or less than that. To answer the second objective, whether there is a relationship between perceived nursing presence and patient demographics. So overall, there was no relationship I have found in this study. Only significantly there was a relationship in between marital status and nursing presence scale. So this might be the family support patient is getting during their treatment and during their treatment phase. This could be the reason that this was positive in all the patients. How could we achieve this? Because we are teaching since since the nurse joins, and we teach the nurses when they are working on the bedside. This is called informal education, and we give diploma in education, diploma in oncology nursing, and a part of that, and we are offering Bachelors of Sciences in oncology setup. This study will enable nurses to care and feel the nursing presence, can indicate good nurse-patient relationship as well as in the therapeutic communication between nurses. And thank you very much for listening. Anyone want more can see. Thank you very much. Any questions?
We will have questions at the end of these presentations.
Thank you very much.
So there is another free paper where I would like to invite Sana Bukhari from Shifa College of Nursing, and her paper is on role and experiences of oncology nurses in breaking the bad news to patients and their families in selected public and private hospitals in Pakistan.
Bismillahirrahmanirrahim. Here is Sana Bukhari from Shifa College of Nursing, and I conducted research on role and experiences of oncology nurses in breaking the bad news to patients and their families in public and private hospital. Under supervision of Dr. Raisa Gul, and who is my primary supervisor, and Ms. Rehana Ilahi, my co-supervisor, and Sumaira Nasir, she is my committee member. So these are the outlines of my study: introductions, purpose of study, research questions, methodology I used in my study, findings and discussion, strength and limitation of my study, recommendations, and conclusion. So first of all, the introduction of the bad news. Bad news is any information that negatively influences patient perception about future. Future perception means what will happen next. And breaking the bad news in oncology setting has gained a great deal of interest because bad news in oncology is frequently disclosed, and it is usually associated with real or perceived discomfort and a risk to life. It is a subjective phenomenon that varies from one individual to another individual. As a cancer diagnosis communicated to the patient, they went into shock and lost part of the information given to them. Consequently, they look at other healthcare professionals, most preferably nurses, to get that information. And nurses help the patient to understand the difficult medical terminologies used by the physician during the breaking bad news. Participation of the oncology nurses in breaking the bad news is highlighted by the importance of the aspects of their gestures, respective posture, maintaining the environment for breaking the bad news, resolving patient stress, and ensuring consistency of the information. Traditionally, breaking the bad news was considered as a physician role. Considering the advantages of the nurse's involvement and the expansion of the nurse's scope of practice, there is a growing awareness and advocacy for their involvement in breaking bad news. So this area was quite unexplored in Pakistani context. That was, I conducted research on this topic. The purpose of this study was to explore the role and experiences of oncology nurses in breaking the bad news to patients with cancer and their families in selected public and private hospitals in Pakistan. So these are the study questions of my study. Research question: what is the role and responsibility of oncology nurses in breaking the bad news? What is their experience of performing this role? And how do nurses working in oncology setting view their role in breaking the bad news? I used qualitative approach for this study by using exploratory descriptive design. Study population I chose for this study was nurses working in the oncology setting, 3 tertiary care public and private hospitals for study settings. And I used purposive sampling for participant selection and collected data by 16 individual face-to-face interviews and 21 observations in the OPD. Only those nurses were selected for this study who were nurses like having 1 year experience in the oncology setting, and nurses who have repeated exposure to the process of breaking the bad news in their career. And I use semi-structured interview guide and observation guide for the purpose of data collection. For ethical consideration, I get IRB approval from all 3 hospitals. After getting IRB approval, I get approval from the head of departments of the relevant hospitals. Furthermore, I get informed consent from the participants as well. For the purpose of data analysis, I use the steps of the Creswell, and I organize the data, then read it back, then start coding, and then merge these codes to form the categories, and then description of these categories. I carried out the rigor of the study by using the Lincoln and Gruba's 1994 criteria. And now it's the portion of the findings and discussion. These are the participants' characteristics of the participants which I have conducted the study. Majority of the participants have the age between the 25 to 35 years, and there were 3 male and 13 females. Year of experience was most of them have between 2 to 10 years, and specialization in oncology, there were 7 nurses who were specialized in oncology. So these are the findings of my study. So I came out with 3 categories. First one is the role and responsibilities of the oncology nurses during breaking bad news. Second is what are the advantages of their involvement in breaking bad news. And the third one is the challenges and the suggestion given by those participants for this process. First of all, the first category was with the 4 subcategories: implementation of the treatment plan. And second one is the educator and the interpreter. According to this, nurses are the healthcare members who implement the treatment plans. When they're present during the phase of the breaking bad news, they're familiar with the context which is conducted by the physician regarding the treatment plan. This enables them to work with the facts instead of making blind actions. Second one is the emotional support and counseling. And the fourth category is problem solver and advocacy. Second category is advantages of the nursing's involvement in breaking bad news, which led to the 2 subcategories, continuity of the care and accuracy of the communication. So nurses are in a better position to respond accurately to the patient and their family's question. Therefore, the nurses should also be well informed about the patient treatment plans and furthermore. So this is the third category. Last category, challenges and suggestion for nurses involvement. And it is with the 3 subcategories: lack of preparedness, that nurses describe that they have lack of competence and the lack of confidence. Lack of competence include the lack of knowledge and the lack of the communication skills they were facing as a challenge. And the second subcategory is limitation affecting performance. Like organizational policies which restrict the communication of the nurses to communicate with the patients and their families. And the third one is the patients and families' reaction after receiving the bad news. So these are the strengths and limitations of my study. Challenges and suggestions were asked at 2 different points, but the responses were quite in accordance with each other. So this synergy among the responses to different questions was observed. It is strength of my study because it shows the confidence in my findings. And the recommended strategies of this study could be useful in most institutions in Pakistan because the participants belongs to the public and private both setups. Limitations includes potential for some loss of data cannot be ruled out completely because the interviews were conducted in Urdu as well as English. So during transcribing and data analysis process, there was a chance. And the second limitation is observation related to the patient prognosis was not carried out, which would have required prolonged engagement in the clinical because it was a master study and it has the time constraint. This is the limitation of my study in this context. These are the recommendations of my study. So first recommendation is nurses should be involved in diagnosis related discussion in addition to the prognosis related discussion. And nurses should participate in all three phases of breaking bad news because most of the nurses were involved during phase of breaking bad news. Nurses should be informed about the discussion topic that what is going to be discussed on the bedside of the patient instead of like blind interaction. Nurses working in oncology must have specialization in oncology nursing. And nurses must be specifically trained in the communication skills regarding this process. Nurses must have defined role and organizational policies which limit the communication skills of the nurses should be discouraged. Keeping the high workload and time constraint in mind, nurse-patient ratio should be maintained. Nurses should be appropriately prepared, enabled, and facilitated to perform their role with required competencies and confidence. This is the conclusion of my study. Although nurses are required to provide extensive care to patients and deal with the concerns and questions of the patients' families, the potential of their role has not been fully acknowledged till now. Participants in this study described the significance of their role caring for the oncology patients and justified the need for their involvement in breaking the bad news. Moreover, they are also identified the need for their involvement in breaking bad news and identified the limitation of their performance related to their preparation and organizational constraint, which must be addressed by appropriate patient care, family members, satisfaction and nurses satisfaction, and psychological health. Thank you.
Thank you, Ms. Sana. We will take questions at the end.
Sure.
So the next presentation is on role and experiences of knowledge about breast self-examination among female employees working in Shaukat Khanum Memorial Cancer Hospital and Research Center, Lahore, Pakistan. And this will be presented by Tanzila Ayas.
Bismillahirrahmanirrahim. Good morning and Assalamu alaikum. My name is Tanzila Ayas. I am a breast care nurse and team leader in outpatient department of Shaukat Hospital. I have done this study as a part of my BS on degree program part. So my co-investigator was Mr. Zaul Masih, and my supervisor was Ms. Frida Khan, whose support and guidance helped us to complete this project. As breast cancer is the most common cancer, that is present in women and the main cause of death of women worldwide. Pakistan has the highest number of incidence of breast cancers among Asian country, and 1 out of 9 women is at risk of having breast cancer during their lifetime. Shaukat Khanum has conducted many activities to give the awareness about breast cancers as the part of workshops, and they also provide education material not only for the patients but also as well for the staff of the Shaukat Khanum Hospital. There are 3 ways to do the breast self-exam. As breast self-examinations, clinical examinations, and mammography. We have selected breast self-exam, that is the basic for identify any abnormality in the breast that as a part of breast health screenings. So objective of my study was assess the knowledge regarding breast self-examination among female employees working in Shaukat Khanum Hospital, Lahore. Study design which I used was quantitative, descriptive, and cross-sectional study. Targeted population was non-medical female staff, age 18 and above. methodology which I have used after the informed consent, which I have got from each participants. I got the response from the according to my questionnaires. However, sample size was 83. The data was collected from the 12 department of the Shaukat Hospital with different job titles. The questionnaires was divided into two portions. One was from the demographical data about the personal informations of the participant, and the second was contain 15 questions which we have adopted from a study which was conducted in Karachi about the breast self-examinations. The analysis of the data was performed on SPSS. Mean age of the samples along with the frequency and percentage for knowledge of the participant were calculated. The most highest number of the education level of our participant was 49.4%. That they were mostly MSc, MA, and at master level. And the lowest level was matriculations, which were healthcare assistant, which are working under the supervision of nursing division. These are the department from where we got response according to our questionnaires. Nursing, healthcare assistant, they are not nurses, but they are working under the supervision of nursing divisions. Human resources department, MIS, outpatient department, OR, basic sciences research, laboratory, quality patient safety department, marketing, pharmacy, radiation, and radiology. The age group of participants, mostly we get the response from the age of 20 to 30 years. The overall results of our study response was 98.9%. 63.9% female were from the age group of 20 to 30. Mean age of the participants was 26 years. Participants were having good knowledge about breast self-examination procedures. That was 91.6%, but 24.1% were not having practice on regular basis, and they had inadequate knowledge about appropriate time to do the breast self-examinations. 43.4% participants were, they have no idea exact timing to do the breast self-exam. That was a figure we got about the correct answers, 47%. 62.4% participants were aware of the techniques of breast self-exam, but 37.3% of participants were totally unaware about the correct technique. I would like to share the percentage of my results for each questionnaires. We have given different options for each questions, and there are the percentage for each option. These are the whole questionnaires. I will not share all, but I will just want to review. This is the all. These are the few questions which I have selected specially that are most relevant to the breast self-exam knowledge. These are the correct answers which I have got according to the questions. There was one question: who should do the breast self-exam? The answers was male and female. So I got correct answers 63.9%. The correct age to start breast self-examinations, the correct answers which I have taken, that was 65.1%. That was above the age of 20s. And appropriate time to do the breast self-exam, that was 47%. They have given correct answers. And frequency of breast self-exam, 42.7%. Once in a month, they should do the breast self-exam. And appropriate position to perform, I have got the result 45.8%. We have given multiple options, and the answers were correct. And correct method of to do breast self-exam, 65.1% give the correct answers. That was, you must use the pad of the fingers. And there was sign and symptoms of related to breast cancers. 88% give correct answers. That was, we have given multiple options that all were Correct. If we have got the discussions according to our study, and we got the compare with other study relevant to our breast self-exam. So about breast self-examinations, responded was high. That was 91.6%. A slight difference was found in a study that was conducted in Saudi Arabia, and their response rate was 93.3%. This difference might be due to the educational level, difference is cultural and participants' knowledge, and the occupational difference and information's accessibility, availability, as this study was conducted in a medical college. Only 41.7% they have practiced breast self exam on occasionally, but not on regular basis. These findings were concurrent with a study by Taiwan that was conducted in 2019. The result was 40.7%, but we are lower with the study that was conducted in 2018 in Ethiopia, and the result was 45.8%. 62.7% had good knowledge about regarding that right techniques for breast self-examination. That was high from a study as compared to a study by Linda 2018, and the results were lower, 36.8%. After the completion of our study, our recommendation was, because we found limited studies that was published about breast self-examinations among non-medical staff in Pakistan. Majority of the study we have found on medical colleges, factory workers, and schools in urban settings, and this represents the need of further studies on non-medical staff of hospitals. Further, there is need to do the study about the barrier that are they feel and they found to practice for the breast self-examinations. A conclusion of my study was, despite having a sound knowledge regarding breast self-examinations, we found its practice was inadequate. Therefore, innovative approaches to behavioral modifications, communications, and interventions are required through sessions and seminars to promote the practice of breast self-examinations by the organization like Shaukat Khanum. So these are the references which we have used to complete our studies. And thank you very much.
Thank you, Tanzila. On this, we will have to move to our last pre-paper, which is on pre-operative thirst assessment and management in cancer patients in tertiary care hospital. And this will be presented by Fozia Ali from Shaukat Khanum Hospital, Lahore.
Thank you so much. Thank you, Mr. Nasir. So my name is Fozia Ali, and I'm nursing lecturer and practitioner at Shaukat Khanum. So my topic that is discussed today, that is pre-operative thirst assessment and management in cancer patients in tertiary care center. So in introduction of my study is preoperative thirst is a common symptom that cause intense patient discomfort, and it's a very powerful symptom that processes all other senses of the patients. So the etiology of the preoperative thirst is complex and has not yet been completely exposed. Preoperative fasting and intraoperative fluid losses may lead to hyperosmolarity and hypovolemia in the patients. So moreover, certain drugs utilized in anesthetic practice, for example, glucopyrrolate and other anticholinergic agents that reduce the risk of salivary secretions, may promote the thirst sensation during sedation, and it's may be further intensified by the prolonged surgical and intubation times. As we know, pre-procedural fasting is required for general anesthesia, and that reduces the risk of vomiting and aspiration pneumonia during sedation. So prolonged fluid restrictions cause thirst symptoms to develop the patient, for example, dryness in the lips and mouth and swollen tongue. There are several factors that contribute to the patient thirst. For example, prolonged fasting and preoperative anxiety and fear trigger hormonal reaction that results in decreased saliva production. And the intraoperative period, medication and orotracheal tubing and bleeding can cause dehydration. So in background, according to the thirst study and research group, sorry. According to the thirst study and research group in 2020, the researcher observed that thirst could continue increase during surgery and is terminating in intense patient discomfort in immediate post-operative phase. The preoperative team members might not be routinely valued, identify, measure, or treat the symptoms on time. So current guidelines related to preoperative fasting for elective procedures recommended the minimum fasting period of 2 hours, nilbar oral, and NPU for clear fluids. Despite all these recommendations, current practice is undergoing surgical procedures other than other medical procedures that require sedation and anesthesia to receive standardized NPU fasting instructions at the pre-specified time interval before procedures. For example, no eating and drinking after midnight is most common. So it's not common for fasting instructions to be updated even when there is a significant delay in surgical procedure starting time. So as a result of prolonged fasting for many hours prior to surgery could lead to unstable hemodynamics, might to be potential harmful, and influences on the cardiac preload and its effect on the post-operative recovery. So these are the purpose and objective of my study, to identify the intensity and discomfort caused by thirst in preoperative patients and to assess the satisfaction level of the patient after thirst management. In cross-sectional study design was used in operating room at Shaukat Khanum Cancer Memorial Hospital and Research Center. The duration of the study was 2 months and 147 patients were enrolled in the study. Convenient sampling technique was used. Patients undergoing surgical procedure of the breast, urology, and orthopedics under general anesthesia were included in this study. And patients less than 12 years and having surgery other than breast, urology, and orthopedics, and who are not willing to participate in the study were excluded from the study. So in results and discussions, there are patient characteristics. 147 patients were participated in the study after informed consent. So age range 12 years to 78 years, and the mean age is 45 years. And as you see in pie graph, 60% patients were female and 40 were male patients. So 80% were patients were day case and 20% were admitted. And I covered 3 specialties, breast and urology and orthopedic. So here are 52% of patients were breast and 43% of urology and 5% was orthopedics. So in surgical procedures, I took different surgical procedures, for example, wide local lumpectomies, mastectomy, cystoscopies, and nephrectomy and removal of implant in orthopedics. So here you can see the maximum patients of cystoscopies, that is 39%, as well as 31% of wide local lumpectomies, and minimum number of removal of implant and nephrectomies. So 98% patient were administered the general anesthesia, and this is the recordable NPU duration before surgery. So 50% patients were reported they had like 16 hours NPU before surgery, and 50% patient reported that they had NPU of 14 hours, and similarly 20% patient reported like they are 12 hours NPU, and 10% stated that 10 hours NPU, and 5% reported that they are 8 hours NPU before surgery. So here are the intensity of the thirst. On 58% patients report they are thirsty, and 40% reported that they are very thirsty, and 2% patients says they are neutral. So discomfort by the thirst, and 98% were reported as a thirsty, and there are various discomfort symptoms that caused by thirst. For example, as you see in graph, dryness in mouth and lips was reported 80% patient, and dryness in tongue 70%, and thickness in saliva 60%, as well as dryness in throat 60%. So 60% patients also report that they have a bad taste in mouth due to the thirst. So after that, assess the intensity and discomfort in patients. Then I offered the management in form of water to 98%. So 40% patient receive management, and 60% patient refuse the management. And there are different reasons to refuse. We can see in next slide. So there are different reasons. In 50% patients stated that doctors strictly stop to hold eating and drinking. So 30% have fear to delay the postpone the operation or surgery, and 18%, sorry, it's a typo error, 18% patient accepted as a culture to remain thirsty. Like they thought that कि उन्हें ये लगता है कि प्यासा रहना बहुत जरूरी है, अगर हम मतलब पानी जरा सा भी ले लेंगे तो हमारा ऑपरेशन डिले हो जाएगा. And 2% said don't want to drink water. So after intervention, in 40% patients assess the satisfaction level. Then 70% patients are very comfortable after management, and 30% patients are comfortable with the management. So here are the conclusion of my study. The incidence of the thirst intensity and discomfort is high in patients during the preoperative period. Thirst need to be evaluated by healthcare team that's work in preoperative area for it to be appropriately treated. However, care improves by proper timely assessment, management of the thirst in surgical patients. So these are the recommendations: management of NPU duration by the effective communication with the patients, by the healthcare team, by nurses and doctors as well, and must perform timely assessment to prevent the patient discomfort, and staff must have know what is the importance of thirst and its management, and must have proper template or performer for recording the thirst level of the patient. So this is the ethical consideration. This study is conducted after IRB approval, and informed consent was taken from the patient participants, and data stored and maintained in log file and accessed by the authorized person. So these are the references, and this is my acknowledgement towards the co-investigator, Dr. Asma, Dr. Asad, and Mr. Basharadullah, and as well as Ms. Shahana Elahi, Director of Nursing, and my family and friends, especially my mother and my husband as well, and family and fellows and colleagues in clinical areas, those nurses who are like support me, and my students as well. And the research department staff, they are continue help to evaluate the data of the study. So any question, and thank you very much.
Thank you very much, Fozia. So this actually ends the research free papers and the session, but because we kept the question and answer to the end, so I would invite the questions, and the participants can question from the speakers, all who have presented since morning, Dr. Parveen Ali, Nasir Khan, and the 4 researchers who were here. So please, for question and answer.
I'm Nadeem Paul from Infection Control, Shaukat Khanum Hospital. My question is to Ms. Fozia, that you explained in your research that you categorize thirsty and very thirsty. I just want to ask that what scale you use to measure the thirsty and very thirsty?
So thank you, Mr. Nadeem. Yes, when we evaluate, it's actually a numeric rate, numeric scale. When I ask the patients, how do you feel thirsty? Then I'll give the number. So very thirsty mean 4 and thirsty mean 3. So when I ask the patient, are you thirsty? I'll give you number. Then this numbers, 4 number shows very thirsty, बहुत ज़्यादा प्यास है. Or like 3 number says प्यास है, or 2 means neutral, प्यास है और नहीं है. So that's why I segregate this data from thirsty to very thirsty.
There's another question. Yes, Mike, pe chale jaye. Okay, so Shahid, Salima, and then Lubna, please. Yeah.
Okay. Assalamu alaikum. Fawzia, you mentioned in your conclusion that most of the patient was thirsty.
Mike, de dijiyega yahan pe, please.
Did you assess the reason behind why they are thirsty? Are they are delayed the surgeries or time duration of the NPOs?
Yes, Mr. Shahid, I'll assess in reason and in duration of NPO. I assess 2 things. One is NPO time of the patient. When there was like kitni der se wo NPO hai, and on my assessment time before surgery, before 2 hours of surgery. Then I compile this NPO duration before surgery.
Thank you so much, Ms. Fawzia, for a very wonderful presentation. So I just had 2 questions in mind. So one is that, did you use any tool or a questionnaire, or what kind of instrument actually did you use to collect the data? And the second one is that you mentioned that the methodology is cross-sectional study design.
Yeah.
And you also mentioned that you offered the management or the intervention to the patients in form of water. So could you clarify that was it the intervention that you intervened? So couldn't it be the interventional design, or it was just that the patient is taking water or not, and on the basis of that, you just observed it? So if you can just clarify.
Okay.
Thank you.
Thank you, Ms. Lima. Yes, I adopted tool from, this is validated and reliable for thirst assessment. And second one is, yes, this is the cross-sectional study design which was used in the study, but I offered the management. So here are the discussion because I done all this thing in one form. Like I assess the patient before 2 hours of surgery, and then after that, within 15 minutes, I'll give the water, and then after 15 to 20 minutes, I assess the satisfaction level of the patient. So this is all these things done in like one time. So this is not like experimental or like interventional design for the patients. So this is approved by my scientific review committee, as you see in my slides. I hope answer is clear to Ms. Salima. Ji. Are you question from my side? Okay.
There's a question here, Lubna, and then Rifat, you can.
Okay. So Ms. Lubna.
So Fawzia,
yes, Ms.
Yes, Salima has asked 2 of my questions. So just to inquire, have you checked the validity of the tool that you used to assess the thirst?
Yes, ma'am. I assessed the all reliability and validity of the tool which was used in already in study of AORN.
All right. And as I would also, have some concern that you utilize some intervention also.
Sorry, miss.
So you utilize some intervention also in the study?
Yes, no, ma'am. Yes, intervention or a management in form of water. Actually, when I proposed select this topic, there are like I offered the patient water, not like other interventions. So that मैं ये सारा काम एक ही वक्त में कर रही थी. For example, I assess the patient. then I offered the water and then reassess or for satisfaction. Those got to intervention, yeah, like a management or a pani. So that's why it's a cross-sectional study design, not interventional.
Thank you.
G, Rifat.
I have a question that in your exclusion criteria, you excluded the pediatric patients under the age of 12 years. So I have seen many times the pediatric patients, they are more crying. And I thought the thirst management is more important in pediatric patients.
Okay.
So the specific reason to excluded these pediatric patients?
Yes, Rifat, I purposely selected 3 specialties and adult patients, and I took like patients above 12 years. And I excluded this study. There are like other multiple reasons, like in patients, we have a like short procedures for IT bone marrows and other like short procedures. That's why we not selected in this study.
Thank you.
I have one question for Mr. Williams. So
we have question for Fozia?
Okay, so Mr. Williams.
No. I want other presenters to come on the
That's
stage.
what I'm saying, that
if
presenters should
William,
come for
Sana and Tanzila can come on the stage, please. Samne aa jaye. So
Dr. Parveen as well. And Nasir, tum bhi
जी मैं question कर लूं. So, Mr. William, I have one question for you. If you have used a tool which was used in the study which was done outside Pakistan, and you have translated their tool to Urdu language to make sure that the data is valid. So how did you ensure the validity and reliability of the tool?
This is translated in Urdu and is checked by the Urdu expert only, not more than that.
Right. Ms. Lubna ne koi question?
Yes. पायलट किया था 5 लोगों पे पायलट किया था जिनको मैंने बाद में स्टडी में इंक्लूड कर लिया. Yes. No.
आपको ऐसा लगा कि बाहर का टूल जो है वो हमारी पॉपुलेशन पे बिल्कुल ठीक जा रहा है?
हाँ जी ठीक जा रहा है.
कोई मॉडिफिकेशन आपने नहीं करी?
No.
किसी एक्सपर्ट से आपने इसको वो करवाया था, रिलायबल चेक या वैलिड चेक?
रिसर्च पॉइंट ऑफ व्यू या इंग्लिश उर्दू पॉइंट ऑफ व्यू?
तो उर्दू, क्योंकि आप उर्दू अपने कॉन्टेक्स्ट में
उर्दू
इस्तेमाल कर रहे थे ना?
दिस इज चेक बाय who is not a researcher, लेकिन he is masters in Urdu. कॉन्टेक्स्ट उसका सब उन्होंने इक्वल किया था, इंग्लिश और उर्दू का कॉन्टेक्स्ट इक्वल किया था.
A question from the presenters. Yes, Ashi, please come to the mic.
ये क्यों नहीं आ रहा? उससे आना चाहिए.
Please, whoever have questions, can you line up in after Ashi so that we save the time?
There are 2 mics. Yeah. Yeah.
Good morning and assalamu alaikum all of you. My name is Ashi Sohail and I'm OR team leader. So my question is for Ms. Fozia. Can you please tell me that after how many hours did you check the thirst of the patient to get you it in your analysis?
Thank you, Ms. Ashi. Yes, I'll assess the patient before 2 hours of surgery, and after intervention, I offered in management in those patients who have like 2 hours surgery time. Then I'll offer the management.
Thank you very much.
I have my questions with Sana first and then Tanzila. So Sana, tell me your reflection. Yeah, the questions, study question you have, taken up. So what is your real, because in your introduction, you said that nurses ka scope of practice बढ़ गया है, तो nurses should be breaking the bad news. Looking at your conclusion slide, it is same. So what is your reflection? कि study के बाद कोई ऐसी novel finding आई हमारे context में?
Your question is a bit not clear to me. Will you please elaborate it more?
So I'm asking कि आपकी study conclusions में अगर मैं आपसे बोलूं कि कोई novel finding आई regarding the topic, what would that be?
Yeah, I think it's about the willingness of the oncology, especially oncology nurses, to participate in the Breaking Bad News, because officially there is a concept that nurses जो हैं वो बहुत busy होती हैं, they don't want to participate in the Breaking Bad News, or their like nature of job is quite different from the this task, Breaking Bad News. So it was an all finding of my study that nurses were showing willingness towards this task.
So I can add on, Sana, because I'm part of study. Sana, because intention was that how much nurses are involved, and if they are involved, where they can see themselves, what is their role. So the she found limitation was, the involvement was limited at the time of breaking diagnosis, whereas it was okay in few of the institutions she did where the prognoses are discussed with the patient. So our reflection again and conclusion would be that nurses need to be involved because they feel it. They feel, the studies shows that nurses are interested to be involved. And but again, they say that if they are involved, they should be involved from the beginning for breaking the bad news, so that they know what the doctor have told and now where are they going to take the lead. And secondly, when the patient asks question, they should be clear. But on the other hand, they need to have time to discuss. So that is why she recommended that we should have a defined role in breaking the bad news. So people don't take it as a burden. It is their role. Secondly, because it is a defined role, so we need to prepare them. We need to prepare them for disease. We need to prepare them for communication. We need to prepare them. It's not like nurses should break the bad news. Bad news is always given by the consultant, the primary physician. But nurses' involvement is in there because people look at nurses for further clarification. Sana, I hope I clarified.
Yes, ma'am.
I was just going to add, I think एक जो चीज है ना वो definition of what is bad news उसके context में है. If bad news is about the bad news तो कुछ भी हो सकती है ना. Bad news ये भी हो सकती है कि जी somebody was coming to meet you and they are not coming. या कोई भी XYZ. So छोटी से छोटी आप अगर chicken खाना चाह रहे थे और chicken available नहीं है, that in itself is a bad news. So depending on context kitna hai, where it comes to the diagnosis or kind of explaining the poor prognosis or somebody is going to die or something like that, I think wahan pe dusre bahut sare factors bhi hai na, because it is about who has got all the test results and everything else, who is reading it, or wahan pe nurse ka role kya hai. So it's all well and good that we are interested, but is that part of the scope of the practice? Is that requirement of the role? Or time kitna hai, बाकी सारी चीजें भी. So I guess probably define as उसका वो है aspect कि you know what is bad news in the context.
को मेरी भी ये एक recommendation है. अभी आप ज़ाहिर इसको अभी आप defend करोगे, right? है ना, अभी defend नहीं किया आपने. So आपने highlight करना है कि हमारे context में, क्योंकि आपका sample भी divided था, कुछ oncology के context में थे और कुछ non-oncology के context.
No. It was totally oncology setup. She did it was for cancer patients, but it was nurses working in inpatient as well as in outpatient.
Yeah. So you need to highlight this. I feel that this is one of the novel finding which is coming up. So discuss this with Dr. Raisa. She's very particular about novel, different findings. So it should be reported as novel and different finding when you publish.
Thank you, ma'am. Thank you for your suggestion. I will follow it.
Okay, so with this, I will. I
have a question.
Thanks. Do you have a question?
Yeah, Tanzila.
Okay, one question from Rubna and one from Sarfraz, and then we close. Yeah. Okay, Rubna, please go ahead.
So Tanzila, it was very, very crispy project that you have taken up. So you mentioned that 91%, around 92%. Women were aware that SBE hota hai aur karna chahiye, but around 40% were practicing it, right? This was your finding, right? So, आप happy नहीं है 41% से के लोग कर रहे हैं practice?
नहीं, शौकत खानम में हर साल बहुत ज़्यादा ब्रेस्ट कैंसर से रिलेटेड अवेयरनेस से रिलेटेड सेमिनार्स भी होते हैं और नर्सिंग डिपार्टमेंट में एजुकेशनल कैलेंडर होता है फॉर अवेयरनेस ऑफ ब्रेस्ट कैंसर्स. सो एंड देयर आर मेनी एक्टिविटीज इवन नर्सेज दे आर कंडक्टिंग ड्यूरिंग द मंथ ऑफ इवन लास्ट मंथ October we have arranged 2-day seminars. So according to our activities, this response was very low because we have did a lot of further awareness. So we have selected non-medical staff because we have reached there are some departments and not that was beyond of our regular approach. So these are the that
कितना percent expect करते हो?
Almost above 90s because we have done a lot of activities to give the awareness, and we also have literature available for the breast cancer self-exam and the exercises. We have a lot of material about the breast cancers, and even we have breast cancers awareness team, breast care nurses 6 and 7. They are playing their role very actively in their departments. So regarding with that compare this response rate was, in my opinion, were lower.
Acha, very good.
Lubna just wanted to add because we were part of the same study. Sure. Even with the 43%, we found somewhere inconsistencies among even those who are practicing. So maybe she's not very much happy with the inconsistencies and the yeah.
Okay, sir. So cancer hospital में आप 90% expect कर रहे हो, right?
No, we in cancer hospital, according to our activities, we are expecting at this.
I think she means the knowledge, the wave of knowledge we are spreading, and the activities of breast cancer which is happening around us, and the informal information in the hospital coming on. So she was not happy with this. Ji, sir.
Expectation. It's just whatever you find, and then you make the changes in the effort so that your goal can be achieved. So, should we look from that perspective?
Thank you. Okay, Assalamu alaikum and good morning. Firstly, congratulations to all presenters of very inspiring presentations. Anyway, my question to Ms. Sana. So, what are it's a very unique topic. Nurses should be engaged in the breaking the bad news.
Yeah.
So what are the practical ways can be part of the recommendation in your studies?
Sorry?
What are the practical ways can be part of the recommendations? Because it's changing the paradigm shift. Because we think as nurses, this is not our role. So what are the practical ways can be part
practical
of the
ways can be indulged to incorporate them in the breaking the bad news, right?
In the recommendations.
In the recommendations. It is really, thank you for your question. It is a really interesting question. I will love to respond to this question. In my suggestion, the part of the challenges and the suggestion, when I was explaining, it was a lack of preparedness. Lack of preparedness means lack of competence, and the competence is a combination of the knowledge, confidence, and the attitude and behavior. So the recommendation, from the practical point of view, knowledge should be updated in the form of specialization, as Shaukat Khanum is offering specialization to nurses. And the second one is the communication skills. Communication skills should be upgraded. And the third one is the attitude and behavior, which is a part of the policy formation. So it is already mentioned in that. And the second one is that defined role, that organization should acknowledge and recognize the role of the nurses to participate in the process of the breaking bad news.
Thank you. Okay, but the third part, it need to think more. Thank you so much.
Thank you, everyone. I will request the presenters to please take seats. I will close the question and answer session here. So on behalf of Organizing Committee and Nursing Division, again, I would like to thank you all for your presence, for your attendance. And since yesterday, we are having 3 national, now become international leaders in our sessions. And we are very proud that our Pakistani nurses are excelling in the world on a very, very, competent and knowledgeable manner. So you can have contact with them in the room and further ask questions. Those who are still keeping their question can contact the young researchers. Why I call young researchers, because this is really a big effort to start a research. So they can contact them and ask further question and clarification. So I'm so thankful for making this question and answer session very lively after having the keynote speakers presentation and our research presentations. So I think we should encourage each other to do more work. And as Dr. Parveen said that it's a difficult journey, but somebody has to start it from somewhere. So we have to start it from somewhere. And I congratulate those who have started already. I want them to, I actually wish them to be success in this arena. For nurses who are attending these sessions, it is very important for them to stay and attend other sessions where they are nominated or they have identified for themselves. We have a plenary session which is at in the afternoon, and it is from 4, somewhere or 3. You can see the program. For your attendance in that session is compulsory because for few of you it is a study day. So please stay and mark your attendance through your RFID card. There's no written attendance. We are not monitoring it, but we are monitoring through the RFID cards. So thank you very much again. God bless you. Pakistan Zindabad.